Renal vein thrombosis is an renal disease. Look at this picture shows that kidney and renal vein thrombosis. Look at this. And Doppler ultrasound findings. Look at this. CT scan with contrast. MR angiography findings. Look at this. And renal venography. A detail going on. Introduction. Renal vein thrombosis is a rare but serious condition characterized by the formation of blood clot thrombus in the renal vein, which drains blood from the kidney. It can lead to impaired kidney function, renal infraction, or even renal failure if not promptly diagnosed and treated. It may occur in both adults and children, but is particularly more common in neonates and individuals with nephrotic syndromes. A definition: renal vein thrombosis is defined as the formation of a thrombus blood clot in one or both renal veins, which can lead to obstruction of venous outflow from the kidneys. Look at this picture shows that etymology. Renal vein thrombosis come from Latin and Greek roots. Renal from Latin renalis means related to the kidney. Vein from Latin veno refers to a blood vessel carrying blood towards the heart. And thrombosis from Greek thrombos meaning clot describes the formation of a blood clot. Together, the term refers to a blood clot forming in the vein that drains blood from the kidney. Types 1. Acute RVT, sudden onset, typically associated with flank pain and hematuria. 2. Chronic RVT develops gradually and may be asymptomatic or present with signs of chronic kidney damage. 3. Unilateral RVT thrombosis in one renal vein. 4. bilateral RBT thrombosis in both renal veins, more severe and commonly seen in neonates. Causes: 1. Nephrotic syndrome, most common in adults. 2. Dehydration, common in neonates. 3. Trauma or surgery. 4. Renal cell carcinoma. 5. Hypercoagulable state. Example: antiphospholipid syndrome, protein CS deficiency. 6. Infections. 7. Vasculitis. 8. Oral contraceptive use. 9. Pregnancy and postpartum state. Risk factors: 1. Nephrotic syndrome. 2. Malignancy. 3. Coagulation disorders. 4. Prolonged immobilization. 5. Use of certain medications, example oral contraceptives. 6. Recent surgery. 7. Dehydration, especially in infants. 8. Sepsis. 9. Trauma to the abdomen. Complications: 1. Acute kidney injury AK. 2. Chronic kidney disease CKD. 3. Renal infections. 4. Pulmonary embolism. 5. Hypertension. 6. Renal vein rupture is rare. Pathophysiology. Here is step by step breakdown of the pathophysiology of renal vein thrombosis RVT. 1. Endothelial injury or hypercoagulable state. Damage to the inner lining of the renal vein or an underlying conditions like nephrotic syndrome, cancer or dehydration triggers clot formation. 2. Activation of the coagulation cascade. The body's clotting mechanism are activated, leading to the formation of a thrombus, blood clot in the renal vein. 3. Partial or complete obstruction of renal vein. The clot blocks blood flow out of the kidney, increasing venous pressure within the organ. 4. Reduced renal perfusion, impaired outflow causes congestion and reduces oxygen and nutrient delivery to kidney tissues. 5. Ischemia and renal parenchymal damage, prolonged reduced blood flow leading to cellular injury and inflammation in the kidney. 6. Decreased glomerular filtration rate GFR. The kidney's ability to filter blood diminishing, possibility leading to acute kidney injury. 7. Potential spread of thrombus. The clot may extend into the inferior vena cava or cause embolization to the lungs. Pulmonary embolism. Signs and symptoms. 1. Flank or abdominal pain. 2. Hematuria, blood in urine. 3. Proteinuria. 4. Edema, especially in nephrotic syndrome. 5. Decreased urine output. 6. Fever if infection is present. 7. Hypertension. 8. Enlarged kidney, palpable mass in neonates. 9. Nausea and vomiting, non-specific symptoms. Diagnosis. A. Laboratory test. 1. Urine analysis, proteinuria, hematuria. 2. Serum, creatinine and BUN to assess kidney function. 3. Coagulation profile. B. Imaging. 1. Doppler ultrasound, initial and non-invasive test. 2. CT scan with contrast confirms clot and extent. 3. MRI or MR angiography. 4. Renal venography, gold standard but rarely used. Nursing diagnosis. 1. Impaired urinary elimination related to obstruction of renal vein. 2. Acute pain related to renal congestion. 3. Risk for impaired renal function. 4. Risk for fluid volume imbalance. 5. Anxiety related to health status and prognosis. 6. Knowledge deficit regarding condition and treatment. Medical management. 1. Anticoagulation therapy, example heparin, warfarin. 2. Thrombolytic therapy in severe cases, example tissue plasminogen activator. 3. Management of underlying cause, example treatment of nephrotic syndrome or malignancy. 4. Surgical intervention, rare thrombectomy or nephrectomy in severe cases. 6. Inferior vena cava IVC filter to prevent pulmonary embolism in high risk patients. Nursing management. 1. Monitor vital signs and intake output. 2. Assess for signs of bleeding, due to anticoagulants. 3. Monitor renal function test. 4. Provide pain relief measures. 5. Educate patients about anticoagulant therapy. 6. Encourage hydration unless contraindicated. 7. Monitor for signs of pulmonary embolism, example chest pain, dyspnea. 8. Support psychological needs. Treatment options: 1. Anticoagulation, mainstay of therapy. 2. Thrombolytics in select patients. 3. IBC filter placement. 4. Surgical thrombectomy. 5. Supportive care, pain control, fluid balance. 6. Treatment of underlying diseases, example steroids or immunosuppressants in nephrotic syndrome. Psychosocial medicine: 1. Counseling and emotional support, address anxiety, depression, and uncertainty about illness. 2. Patients and family education, inform about the disease process, medication adherence, and lifestyle modifications. 3. Support groups, connect patients with others who have similar conditions for emotional support. 5. Stress management techniques, encourage mindfulness, relaxation, exercises, or breathing techniques. 6. Social work involvement, assist with healthcare access, insurance issues, and rehabilitation support. Prevention: 1. Early diagnosis and treatment of nephrotic syndrome. 2. Adequate hydration, especially in high risk infants. 3. Prophylactic anticoagulant in high risk surgical patients. 4. Avoidance of unnecessary immobilization. 5. Regular monitoring for thrombotic events in hypercoagulation patients. 6. Smoking cessation and lifestyle changes to improve vascular health. In conclusion, renal vein thrombosis, though rare, is a potentially life-threatening condition. If not promptly diagnosed and treated, it is often associated with nephrotic syndrome and other hypercoagulable state. Early recognition, appropriate medical management, and nursing care are essential in preventing long-term complications. A multidisciplinary approach, including psychosocial support, plays a vital role in holistic patient recovery and improving quality of life. Thank you. Have a nice day.